inevitably you were going to mention the pandemic, because that must have had an impact. But one of the first questions that's come in already from Paul is, have you seen a big increase in mental health problems since COVID? We're all being told that there has been, but is that the reality?
I think two things have happened. One is that there was a really significant psychological impact of the pandemic, and we know from any natural disaster that has a psychological impact that affects people's mental health during and for months and months and months and years to follow. Yeah. And the pandemic was no different in that respect. So, people died, so people grieved, so people lost people. A lot of people lost their jobs or had their employment affected by it. Things changed. A lot of people became socially isolated and lonely, and those things are bad for your mental health. So all those things happened, and they happened in a concentrated period of time. Yeah. And secondly, and not entirely a bad thing, it's the first time we've had an event like that where people actually talked about the psychological impact, talked about mental health as part of the pandemic, and understanding that. So just before, I mentioned Public Health England, so in the run-up to the pandemic, at the start of the pandemic, I was in England's leading public health organisation 2 days a week. We just didn't know what to expect. You prepare for these things, but you really don't know what they're going to be like. But one thing that was very clear was that it wasn't just about a virus. The psychological, the mental health impact of the pandemic was as damaging and as significant in the short, medium, and longer term as it was as the physical health terms were. And I think it was dreadful, but it was immensely helpful that people saw it as both a mental and physical health event.